Now, one of the principal points I want to make in this today is that these three ways of dealing with dysfunction in a spouse are different. They're the same, but they're different. For instance, the husband-dominated one, the symptoms will eventually come to be in the wife. And in this one, the symptoms will eventually come to be in the husband. In the intensity of the fusion, one is done in by the fusion. They come to a state of dysfunction. A characteristic of the people who develop physical illness, I'd say physical illness is the one most prominent adaptive mechanism in people who get sick. As a group, the early life indoctrination or programming had to do with attention to body functioning. And this would be an environment, say, in which the parents or the environment explained emotional disharmony with physical reasons. It's because you didn't get sleep, it's because of your stomach, whatever. Your bowels didn't move or that sort of thing. So that is one of the many, many characteristics in that. So these are people who focus on body. Now, as long as there's reasonable flexibility in this adaptiveness, they might go back and forth with minor symptoms, but increase the anxiety, and it moves toward symptom development in the dysfunctional spouse. The dysfunction can be anything from repeated physical illness that doesn't heal rapidly. It can be a chronic illness that's lighted up at a time of anxiety. It can be, I believe, that illness can be triggered by anxiety. For instance, somebody might have a chronic gallbladder that's been present for a long time, and with an increase in anxiety, the anxiety focuses on the organ system, and it can light up the symptom, light up the illness. In other words, it can take a chronic disease and make it into an acute one, into an acute surgical operation. It can take something like diabetes, which has been programmed into the organism for years, and suddenly in this anxiety field, it can become clinical diabetes. Some of the thinking in recent years has gone to the sort of conviction that anxiety can play a part in triggering the development of a cancer even. We have pretty good evidence that it can trigger the development of cardiac problems. For instance, somebody who's been developing a heart problem for years in an anxiety field can suddenly have the closing off of the coronaries that can kill. In say a malignancy, this is where some thinking goes, and this is thinking that we've used for a number of years, and there's no proof for it, but we still keep it as a pretty solid hypothesis, and that the malignant cell has been dormant in the body since birth. Among the various triggers that can trigger this cell into activity, whether it be physiological or pathogenic or whatever, carcinogenic, I believe that anxiety is one of the triggers. In the past, I've used the analogy of the development of a hurricane that takes a number of different conditions to cause the hurricane to develop. And if any one of them is not present, the hurricane cannot develop. If you apply the same thinking to malignancy, it would say that it might be one of the necessary conditions for the development of a clinical cancer. This has been the direction of more and more of our study.